are live here at ASAPS 2019 in New Orleans, and I'm here with Dr. Herluf Lund, right?
Well, I'll help you with the pronunciation. It's Herluf.
Herluf?
Lund.
Herluf. Lund.
Yep.
Okay. And you said it's Swedish?
Danish.
Danish. All right.
Yeah, don't worry, everyone gets it wrong. Just in that, it's a great introductory way for me to introduce myself to people because it's a great icebreaker.
Yeah, it is. And we're here at ASAPS, and what are you here for? Tell us a little about yourself.
I'm here. I am here because I'm the president-elect of the society, so I probably means I should be here. But I also come because this is absolutely the best place to get an education on aesthetic surgery and medicine, and absolutely the best exhibit hall because we have everything here. It's some of the stuff I look at and go like, wow, why don't I have this? And if I could afford all of it, I probably would.
Yeah. There's a lot of really cool technology
There
products.
is. And you see people walking around dressed like a statue here too sometimes.
Yeah, there's a lot of fun things too. Any new initiatives that you guys are working on with ASAPS?
Really doing a lot of exciting things out there for the patients. We're really working on trying to make sure we up the grade on patient safety. Mm-hmm. That is something the Food and Drug Administration has charged us with, and we've taken it to heart and been very serious with it. The FDA even complimented us on. For our members, we've changed their whole web presence and that, so we're going to make ourselves much more user-friendly.
That's great. Love it. Now we're done with the ASAPS questions. Let's move on to breast talks. So I know that a lot of people know about what to do before breast talks to prepare, but let's talk a little bit about what you do after breast talks.
Yeah, that's the funny thing. Women are so used to being counseled ahead of time about what to do with the questions you should ask before you have an implant, how you prepare yourself to undergo breast augmentation, and very few patients actually ask, what do you do after you have this? And really you have to think of these are devices. They're going to be in your body for a long term, and you should be thinking of them just like anything else. So what do I do with the long-term monitoring and maintenance of them? And so they aren't permanent devices, they are long-term, but if you get a breast implant, you possibly in your lifetime are going to have to get a new set of implants at some time or some alteration, and that's just simply because breasts are dynamic. They age just like you age, and so they're not going to stay the same. But then the big push these days is how do we monitor? And it used to be that many patients would have their augmentation. 3 months after, the doctor would say, you look great, see you later, and come call me if there's ever a problem. But that's not what the future is. Mm-hmm. The future now is we want to have you come back on a regular basis, every year, every other year. The protocols vary a little bit. And also, very importantly, we want to monitor the implants, and particularly silicone gel implants.
Okay. And speaking of monitoring, so I know that a hot topic this year is the ALC, all the recent regulations and breast implant illness. You want to tell us a little bit about that?
Well, ALCL, which stands for anaplastic large cell lymphoma, which is a type of malignancy of one of the white cells in our immune system. There is a rare but now identifiable association with certain types of breast implants. Mm-hmm. So far it seems to be more with a textured device. The numbers are very small worldwide. Okay. It's not just the implant alone. There's a lot of other factors that come into play there, but women who have those implants should be contacting their plastic surgeons and should be coming in to be seen. They should call them and if they have questions, and they certainly should be following along, like at the ASAPS, the American Society for Aesthetic Plastic Surgery website, because we have a lot of information for them on what they should be looking for and monitoring. For a patient who has an implant and is concerned, what the most common presenting symptom is swelling of one breast significantly more than one other one. Okay. That's the usual opening thing we see. But anything they're concerned about, they should come in and see their plastic surgeon.
Yeah, and you said that there's resources on the website too?
There is. There's a lot of information on the website. We can also have, there's links to other places that will give them more information. There's a lot of misinformation out there. That's why it's important that you go to a credible site.
Okay. Awesome. Well, thanks so much for sitting down and sharing a little bit with us and taking the time.
My pleasure.
Awesome.